Birth defects are differences in the way a child's body develops in fertile stage. These changes can affect any part of the child's body. Some are detected during pregnancy, some after the baby is born, while some later during the child's life. Some are visible, while some are invisible. Some affect their thinking, their movements, and their actions. Some are even life-threatening. Causes of birth defects. Side effect from a particular medication can be one of the causes of birth defects. Substance or chemical exposure, pregnancy complications, and genetic changes. Structural abnormalities of the fetus during scan is another sign that there is going to be a birth defect. Extra amniotic fluid on the fetus is another sign. Then when the child is an infant, abnormal heart rhythm is a sign. When the child is being checked, is a sign of birth defect. Breathing difficulty is a sign. As the child keeps growing, wow, you shout, you call the child, hey Clinton, where are you? Clinton is not far from you, but he can't hear you. It's a birth defect. Feeding difficulties. You see some children, they buy multivitamin, they buy cyproheptadine contained drugs to boost their feeding ability or their feeding appetite, all to no avail. That is a birth defect. Another is some funny appearances of the head, face, eyes, ears. You see some people with half past 4 eyes, half ears, funny looking faces, and so on and so forth. All these things are birth defects. About the risk factors. A child born with birth defect stands the risk of diabetes, obesity, and the worst part of it is that these things can transfer from one generation to another. Note, even marasmus is another risk factor of birth defect. Diagnosed: blood screening, ultrasound, serum screening, and anomaly ultrasound. How can these birth defects be managed? Surgery is one. Religious follow of medications is another. Physical therapy, using of devices such as hearing aids, glasses, wheelchair. Lastly, educational support for such